Well, my name is Matt Erdmann. I'm a consultant plastic surgeon based at the University Hospital of North Durham, but I work privately from the Washington Hospital, the Spire Washington Hospital in Picktree Lane, Washington, in the northeast of England. My areas of expertise in cosmetic surgery are the breast surgery in all its forms. That's breast enlargement, breast reduction, and so-called uplifting procedures or mastopexy. I also do facial surgery, including facelifts, rhinoplasties, blepharoplasties, and eyebrow surgery. Well, I went into plastic surgery having done a surgical training scheme in London, and then became a registrar and trained both in the units within London and then on to Edinburgh, finishing off at the large Canisburn unit in Glasgow. Spent 2.5 years there and then became a consultant in the northeast in Durham in 1997. I became a plastic surgeon based on experiences I've had as a youngster, I always like to use my hands, as all young boys do, working with Lego and then working with Meccano. And I've always liked working with fine instruments, so I think my level of dexterity was something which appealed then in the specialties of either orthopedic surgery or general surgery, and then the subspecialty of plastic surgery became something which appealed a lot to me, and I then embarked on that training program. I think the ability, what I like most about being a plastic surgeon is the ability to change appearances for the better. A lot of patients come in with demands or requests to have their appearance changed, which may not be realistic, and ability to understand that and then work with them towards getting the best outcome for them. The smile of satisfaction on a patient's face when they've had the outcome that they expect is second to none. So that's, for me, the best, the gratification I get from plastic surgery. Right, well, I normally get up very early. I tend to get up nowadays at about 6 in the morning. And, but that, for me, that's a very special time. Everything's very quiet and I can do a lot of work, both on PC and reading. I do a lot of reading of journals and of medical textbooks, and often brush up on my patients for later on the same day. So I'll go over photographs and I'll go over, in my own mind, the planned procedure which I'll do later on that day. I then normally start work at around about 7:30 to 8, and that involves seeing the patients beforehand, consenting them, marking, discussing issues both with the patients and then also with theatres, making sure the implants are in stock that I've ordered, and then discussion with anaesthetists with if there are any problems, any medical problems with the patients. And then theatre would normally start between 8:30 and 9 o'clock in the morning, and will carry on until about 1 o'clock in the afternoon.